Welcome, everyone. We're just waiting on a few other people to join in, so we should be starting momentarily in a few minutes. Thank you for your patience. Good evening, everyone. Thank you for being here today. We should start the conversation in around 1 minute or so. We're waiting for people to log on and choose their languages. If you've just joined and you want to select a different language, we have 4 other options for you today. We have Punjabi, Urdu, Bengali, and Tamil. You are able to change your room by clicking on the globe button on the bottom bar of your computer screen and selecting the language that you wish to hear. If you have any questions or you're unable to change your channel, please put it in the chat function and we will be happy to assist you. Thank you. Okay, I think we're ready to start. Welcome, everyone. Good evening. Once again, today's event will be in English, but live interpretation will be available in Punjabi, Urdu, Bengali, and Tamil. If you're here today and wish to switch to another language, once again, please click the globe on the bottom bar and select the language of your choice. Welcome, my name is Sabina Vorhamiller, and I'm the co-founder of the South Asian Health Network. I would like to start by acknowledging the land that I am on, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We are grateful and indebted for the opportunity to gather on this land known as Turtle Island. The South Asian Health Network is a grassroots volunteer-based organization that was created in order to advocate for the health and well-being of the South Asian community, which has been disproportionately impacted during the COVID-19 pandemic, as well as to provide educational information and resources for our community in a number of key South Asian languages. Our small but mighty team consists of physicians, scientists, and other healthcare professionals. We believe strongly in the magic of community-based approaches. So thank you to our incredible community partners for putting together this town hall today, with special thanks to Regent Park and South Riverdale Community Health Centers. We are grateful for your support and all the work that you do in our communities. Nearly a month ago, Health Canada approved the Pfizer vaccine for use in children 5 to 11. As parents, protecting and keeping our children safe is a responsibility we take very seriously. We have received many questions on the pediatric vaccines from parents within our community, and we hope today we can address as many of these as possible with the help of 2 extraordinary guests. It is my absolute pleasure to introduce our two speakers for tonight. First, we have Dr. Geeta Wahi. Dr. Wahi is an associate professor in the Department of Pediatrics at McMaster University and a pediatrician at McMaster Children's Hospital. Her clinical work includes pediatric hospital medicine and the treatment of childhood obesity. Her research focus includes understanding the intersection of health equity and the contribution of early life exposures to the trajectory of childhood health and well-being. Welcome, Dr. Wahi. Amazing. Next, we have Dr. Nisha Tampy. Dr. Tampy completed her medical training, pediatrics residency, and subspecialty training in infectious diseases at the University of Toronto and the Hospital for Sick Children in Toronto. She obtained a Master's of Science degree in Public Health from the London School of Hygiene and Tropical Medicine and returned to Toronto to do a clinical research fellowship with the Antimicrobial Stewardship Program at Mount Sinai Hospital and the University Health Network in Toronto. She joined the Division of Infectious Diseases at the Children's Hospital of Eastern Ontario, also known as CHEO, in 2013. Welcome, Dr. Tampy.
Thank you for having me.
Okay, amazing. So I know people have a lot of questions today, and we've actually received quite a few questions from our community ambassadors, as well as our communities across Ontario. And what we've done today is compiled a list of questions that have been asked most frequently by parents in our community. So I'm going to start with some of those questions. As we go through, if there are attendees who have additional questions, please put that in our Q&A box, as you can see that in the bottom bar of your computer screen. If you can actually put your questions in the question and answer box, we will try and get to it towards the end of this webinar, but we're going to start with the questions that we've received from our community members. First of all, I'm going to start with you, Dr. Wahi. How many doses do children get, and what dose do they get?
Yeah, that's an important question, because for the children 5 to 11, the dose is actually different than what's given to children 12 and over. So the dose for children 5 to 11 is actually a third of the dose. So it's 10 micrograms instead of 30 micrograms. And right now, the children are approved for 2 doses, and our National Advisory Committee on Immunizations has suggested that those 2 doses be 8 weeks apart.
Amazing. I know that's a question that we get very often, because there is a slight dose difference between adults and children. And so thank you for outlining that. The next question for Dr. Tampy: is the vaccine safe? Are there any side effects to be aware of? I know this is a question that is on every parent's mind, so thank you for taking this question today.
Yeah, I think that's a really important question. And as a parent myself, it was definitely something that was on my radar when I was reviewing the trial data for the vaccines at every age, but especially for my kids' age, which is they're between 5 and 11. So in the vaccine trial, which had thousands of kids enrolled, the vaccine was found to be very safe. And when I say safe, I'm talking about both in terms of the immediate reactions following the vaccine, just speaking to the body's response to it, and then the adverse events profile. So the events that were happening in the days that followed the vaccine. So they found fairly low rates, like less than 10% of kids would have fevers and would have there were more kids who had some pain at the site, but adults have that too. And it's fairly short-lived and it responds well to pain medicines. And then very, very, very few concerns of the adverse events. In the trial, they actually didn't even see anyone who had myocarditis, or that inflammation around the heart. And today, actually, the Center for Disease Control and Prevention presented early information out of their real world experience. So out of the 3 million kids who've had a second dose, very, very few reports of myocarditis, that inflammation around the heart. You just saw a little Santa there. Thanks. You saw, sorry about that. It's very few kids who had any concern of myocarditis, and those very few cases, I'm saying like less than 10 cases that they reviewed have all recovered. So that's very encouraging in terms of safety from the trial, and that's correlated well with what they're seeing in the real world. And again, we're talking about 3 million doses, 3 million kids who've had their second dose, and more than 5 million who've had their first dose.
That is very reassuring. I have to admit, really like seeing all this data coming from the US, given that they had a couple of weeks ahead of us. We have that advantage of actually being able to glean some of this information from their rollout. So fantastic. Thank you for sharing that with us. Dr. Wahi, for you, the next question is, I have heard that COVID-19 is not usually serious in children. So what are the benefits for the kids to get vaccinated?
Yeah, that's a really good question, and something I've spoken to a lot of families that I see in clinic a lot. I think the core issue is that we need to protect children and families. So the number one reason for children to get the COVID-19 vaccine is to protect them against illness. Now, you're right, most children who are infected with COVID-19 have mild symptoms, but there are a small percentage of children who've been hospitalized, and some who've even needed intensive care. So when I work in the hospital, I look after children who are admitted to hospital, and I've looked after children with COVID-19. And right now, we can't reliably predict which child will have mild disease compared to those that will be hospitalized. So I think it's important that we protect all children. Another reason is that outside of the acute illness, that might be mild, we know that some children have gone on to develop post-viral syndromes. So one of these syndromes is an inflammatory syndrome, and it's called multi-system inflammatory syndrome of children. And so children, usually about 6 weeks after having COVID, could come in with prolonged fever. They could have some GI symptoms like nausea or vomiting, and they could have heart complications. And all of these children that have had MIS-C have had to be admitted to hospital for treatment. The other complication, which we're still learning lots about, is something called long COVID, or children who've had persistent symptoms even after mild disease that still goes on. So I think, the risk of hospitalization, the risk of post-COVID complications are all good reasons to be protected. And then I think we have to think about what children and families have had to go through, right, over the last now almost 22 months of disruptions to school and social interactions, family interactions, extracurricular activities. Immunization is another layer of protection, along with other public health measures to protect our children and our families.
Yeah, I think those points are so important, especially right now as we're seeing, across Canada, the cases in schools, especially children under the ages of 12, are steeply rising. So I think that these are such excellent points to talk about with respect to the fact that, it can be unpredictable, as you mentioned, as well as getting kids back to the things that they love and enjoy, things like sleepovers and birthday parties, all of these advantages that are things that kids have missed out for, as you said, almost 2 years now. So absolutely, such great points. Dr. Tampy, for you is the next question. Why is a recommendation to give the second dose 8 weeks after the first dose? What did Health Canada approve, and what is the US doing?
Great question, because at least with this one, we can talk about some real world experience specific to Canada and our what we've seen in terms of vaccine effectiveness and the duration of protection. And that seems to be better with an 8-week interval than it is with a shorter interval. Although, the drop off that we see in adults may not be the same as we see in kids. So there's a bit of unknown in terms of whether 8 weeks is optimal in children. We do have the vaccine that's approved for use in kids with a second dose that can be given at minimum 3 weeks after. But I think, asking the question, can you choose a shorter interval? For me, it's all about knowing what you're choosing. And there are trade-offs in both regards. So going with a shorter term interval allows for, theoretically allows for protection earlier on. And we will see more of that data in real time in the United States as cases of Omicron go up, especially in the children population. And so, we may be getting some short-term, we might be getting some protection sooner, but it may be shorter lived because the two doses are coming a bit closer than what we would want to see for maximal long-term protection. So, recognizing those trade-offs is important. For me, an important trade-off would be about the harms associated with two doses closer compared to longer. And so the question that I answered previously about having a reassuring lack of signals out of the US, at least early data, and they were really talking about not the entire 3 million cases, but or doses, but a fair number of them that were reported back was very reassuring. So I think that's an important consideration. And then finally, with Omicron taking hold in our community, what is the severity of disease that we're seeing in children who have no vaccine for protection versus one vaccine dose, and whether those cases of MIS-C that Dr. Vahi was talking about is still a concern for those kids who have that one dose and who are waiting the 8 weeks out for the second dose. So it's a tough question to answer and a tough decision to make as a parent because we're in the absence of information. But I think there are merits to both approaches, and it's really being informed about being informed about the situation in your community, the risks to your family, and the circumstances around having earlier protection offered sooner with the shorter interval.
Yeah, as they say in a pandemic, there is no good choices, only tough options that we have to make, right? And so absolutely, I think putting all of that into context is so important. Dr. Vahi, next question for you. Have we tested the vaccine for long enough? What about long-term effects? Is this something that we need to be worried about? And I know this question comes up very often, not just in children, but also in adults, but I think particularly in children because parents are, concerned about whether they have to worry about their children down the road when it comes down to a vaccine. So it's a very, very valid question and would love to hear your thoughts on it.
Yeah, I think, we think about long-term side effects and, there's no expectation that there'll be long-term side effects from the vaccine. If anything, there may be probably a higher risk of having long-term side effects from having the COVID infection. And so I think it's a trade-off of risks. But, the way I've heard the mRNA vaccine described, and both of you may have other ways that you've heard it described, but it provides an instruction or manual to your body to make a spike protein against the virus, and then your body essentially rips it up. So it's not like it's sitting around there waiting to give you long-term side effects. It's not actually there for that long. I think every family has to make a decision that's best for them. But it's a safe vaccine that is shown to be very effective in this age group.
I was also very reassured to see, I was looking at latest stats the other day, and we've actually given 8.5 billion doses of vaccines globally right now. And just that number, that sheer number. And of course, with that, all the data that we have on efficacy and safety, it's just incredible to see what we've done in basically a year's time. It's actually exactly a year since we approved vaccines around the world, and 8.5 billion doses. That number is just completely mind-blowing. So yeah. Okay, continuing on the line of safety, the other question we get very often, and Dr. Tampy, I'm going to pose this to you, is on myocarditis. We hear a lot about myocarditis in the news, and it does cause a lot of apprehension. It makes parents confused about whether it's a big deal, whether it's not a big deal, whether parents should be worried about myocarditis. I was wondering if perhaps you could give us some information on it and help reassure parents what myocarditis is, as well as whether they should be concerned about it.
Okay, so we're going to do like infectious disease 101 in a very few minutes. I have to say that the word myocarditis was also concerning for me early on, because as an infectious disease physician in children, when I would see myocarditis before the pandemic, it was hard. These kids had inflammation of inflammation of the muscle or the sac surrounding the heart. And they were tired because their heart was so inflamed, or the space around it was so inflamed, that it just wasn't working well. That is not the kind of myocarditis that we're seeing related to the vaccine. That can be the kind of myocarditis that we see after COVID. So, in my mind, when I think about myocarditis, I think about it before the pandemic, so related to other viruses, and that risk is still there as we start to see, more viral infection spreading in our community. So I expect that we're going to see cases related to that. Then there's the myocarditis related to COVID-19, but also related to MIS-C, which is like 6 times the risk than related to the vaccine. And the kids that we've seen in our hospital with myocarditis following the vaccine, we only know it's myocarditis because they had mild chest pain, which in this period of heightened concern and scrutiny, like looking for it, we would see a change in some of the chemicals in their body that had like no significant change to the way that they were able to function. So they weren't, bedridden for days to weeks and needing to take intense immune suppressive therapy to help them overcome this inflammation. It was so mild that, many of them would actually resolve on their own, and then others would respond with like Tylenol or Advil, so I'm not flippant about the concern of myocarditis. It's more that I'm reassured at how different it is from the myocarditis related to infection, which in my mind, every child will be exposed to that infection. I was saying every child would be exposed when we had Delta in our community, but surely that's going to happen with Omicron, right? So in my mind, the most important part of the vaccines in kids is getting that first dose, because it's only with that first dose that you can then line up for your second when the time comes, or when the time is right. So and we still have to learn about whether myocarditis related to MIS-C is an issue for kids if they've had one dose on board. But so far, again, it's very reassuring that we're not seeing high rates of myocarditis in the US population, and that we've had at least no reported cases so far in Ontario with our rollout, and in a much lower proportion of kids who are in that like 12 to 15 age group who have myocarditis compared to the young adult age group, which again has been mild, right? So
yeah, I think, it's really interesting, because when I talk about, vaccines or any medications, we put everything into that risk benefit, analysis. That context is so important, because of truly, there's nothing in life that carries zero risk. You go into your car, you drive to work, that's a risk you take, but it's a calculated risk that you take, right? And I think similarly here, I think that what you've described to us is really putting all of that risk and benefit into context. And that, yes, there is a small possibility of myocarditis occurring with the vaccines, but they tend to be much milder and less often than what we see with actual COVID infections. And as you said, I think we're at a point where if you're not vaccinated or you're under vaccinated, Omicron will find you. And so at that point, how do you take the risks, vaccines versus infections? Again, so important to put that into context. So thank you so much for taking us through that. Continuing on the theme of safety, another question that we get very often is whether the vaccine can impact fertility. And we've heard a couple of anecdotal as well as some case reports with respect to changes to menstrual cycles. So Dr. Wahi, for you, I'd like to ask you whether, will the vaccine affect their kids, either fertility or if they're menstruating, their menstrual cycles?
Yeah, I think I think my answers are going to sound repetitive tonight, but, similar to the idea that the question around long-term side effects, there's no reason for us to think that the COVID-19 vaccine should affect a child or adult's fertility in the future. It's just not how the vaccine works, and it's not what it affects. So I think, trials have been done, and again, what you said, over 8 billion people around the world have had the vaccine, and it's been shown to be safe and effective. And that should not be a worry that folks have.
Yeah, that's fantastic. I know I just can't get over the 8 billion, doses fact. And it's also very interesting because I was reading recently that the actual endometrium, the lining, has tons of immune cells in it, which was something I didn't know of before. So it was something for sure very new to me. So it makes sense that sometimes a vaccine could possibly impact, lots of things impact menstrual cycles. I mean, how many times have we been stressed out and had changes to our menstrual cycles? And so, I think it's really reassuring to know that even if something like this occurs, it does not mean that it's actually impacting fertility, which I think is the big question that parents have.
Mm-hmm.
Okay, the next question is, do the vaccines affect DNA or cause any changes to DNA? And Dr. Tampy, I'm going to throw that one out to you.
Well, that one's easy to answer because Dr. Wahi answered it before. It's about getting a recipe to giving the immune system a recipe to respond to the virus when it sees it next. But there's nothing that stays. It doesn't incorporate into the DNA. It doesn't stick on tissues afterwards. And it really doesn't last more than days in the body. So no, short answer.
I know. I think it's just sometimes people see the word mRNA and they think that, automatically it means that it's actually impacting. So it's really, really reassuring to know there is no long-term impacts. It does not impact the DNA. So these are all very reassuring things, I think, for parents to hear. We also get a lot of questions on efficacy related things, and especially in current situation where things are a little complicated and waiting to hear some more information. So the next couple of questions are going to be targeted towards some of these questions we're getting on efficacy. So the first question, Dr. Wahi, I'm going to put this one to you. My child turns 12 next year. Should I wait to get them vaccinated with a higher dose? As you were mentioning, there is a difference between the doses for the 5 to 11 age group versus the above 12. And the second part of this question is, does the lower dose provide enough protection?
Mm-hmm. So I'll share with everyone that I have an 11-year-old who's turning 12 in March. So I thought about this question, not only for my patients, but for my own family. And the recommendation is that you get the first vaccine available to you. So my daughter, who's quite tall, and I said, should I be waiting to the new year? No, I got her the first dose available, which she's received. And what public health has suggested is that if your child turns 12 before the second dose, they would get then the 12-year-old dose. She doesn't. She'll still be 11 when her second dose is due. And so she'll get the 11-year-old dose. And the way that we need to think about vaccines is a little bit different than we think about medications. When we dose medications in children, we always need to know their weight, and we always do it by their weight. Vaccines are different. They're not weight-based, but they're based on your development, the development of your immune system. So the recommendation is get the first available dose to you and based on your age. So I hope that's clear.
Oh, absolutely.
Yeah.
Yeah, for sure. I think that cusp question is definitely something that comes up very often. And I also think that in the clinical trials, correct me if I'm wrong, but there were sufficient children in that age group, in the 10, 11, approaching nearly 12 age group. And in the studies, we found that this dose was very efficacious as well. So I think all of this data is very reassuring. We're seeing that coming out from the US too. So, okay, that's great. This is where things get a little complicated. We are exactly, 9 days out from Christmas. And so most kids at this point would have had one dose of the vaccine and wouldn't be eligible for their second dose with the 8-week interval until the new year. So the questions that we're getting is, how effective is one dose of the vaccine as we head into the holiday season? So Dr. Tampy, I'm going to put that one to you.
So that's a tough one, because there are two kinds of variants that our kids and our community are facing this holiday season. There's the Delta variant that has been around since before the summer, and then there is this Omicron variant that's been shown to be much more transmissible and associated with reduced vaccine effectiveness. So I would say that, when we're talking about effectiveness, like how well does it protect me? Not well enough on its own. And that's just, and that's where we are, and instead of being in despair about it, I'd like to think that we can take some comfort in knowing that what worked last year will actually help this year, and being vigilant with the practices that we had in place last holiday season to continue to protect kids and other vulnerable individuals or people who are not eligible for the vaccine yet, like even younger children. Including masking and playing and connecting with people outside in well-ventilated spaces. And even when we talk about masking, cannot overemphasize the importance of a well-fitted mask to minimize the amount of leak. It really makes a difference. So, for children, against Omicron and specifically against the severe outcomes of COVID, as well as the risk of MIS-C, we're not going to have those data before the holiday season. But we have to assume that the reduce in the vaccine effectiveness that we've seen in adults will not be so different in kids. And then it'll be about trying to reduce their risk of being exposed to it. Sometimes that'll mean for adults that we have to change our actions to not bring the virus home. And that's where those community measures come into play. That's where our individual actions around masking and distancing come into play. And that's where workplace policies for paid sick leave and vaccination will come into play. So yeah, it's not just vaccines that are going to help us get through this season.
That's such a great point. And I think this is where we can all collectively do a lot of things to try and risk mitigate. I think I love that whole Swiss cheese model that we've seen many times now during the pandemic, with each layer adding to reducing your risk. And, that would be masking, as you said, ventilation, vaccination being a huge part of it. But all of these things collectively reduce your risk. And I think that's going to be extremely important, especially reducing contacts, reducing exposures, given that we are now seeing an exponential rise in cases as we head into the holiday season. So I think that's such a great reminder and such a timely reminder as we head into the holiday season. But I do have a follow-up question for you, Dr. Tampy, kind of relating to this. And you sort of, talked about it in your response, but what about Omicron? And so what do we know about the vaccines, how effective they are, not just even in pediatrics, but in general also, how effective are they against the new variant?
Yeah, so people have probably heard by now that it's not that effective. They're not as effective. The 2-dose vaccine series is not as effective against this Omicron variant. That's from mean, mind you, that's from studies out of the UK as well as from South Africa, and those populations are slightly different, but I don't think that they're that far off the mark, especially as we hear about fully vaccinated individuals going on to have symptomatic disease. And when you have symptoms, you're more likely to transmit to others, even though I appreciate that when we're pre-symptomatic, we can still transmit. But certainly in the presence of symptoms, I'd be very worried about transmission. So all to say that, you know, against severe disease, we have reduced effectiveness, but it's still better than overall symptomatic disease. So, and then what the UK group has found in their early reports of it is that the individuals who get the booster have it's like a rebound effect of protection. So the protection after 2 doses starts to wane after about 9-10 weeks. So after 2 months, it starts to decrease. And then when you get boosted 2 weeks after that, you get back to those levels of about 70-80%. Over 80%.
Yeah, and I know this is a pediatric town hall, but I think I'm going to make a shameless plug for anyone who's eligible to get your booster. Please go out and get your booster, because again, you know, not only are you protecting yourself, but you're also protecting your children in that. And I know, Dr. Tampy, you and I have spoken about just the indirect benefits of protecting children by adults being fully vaccinated as well.
And that's where I think workplace policies come into effect, not necessarily mandates, I'm saying, but just around, you know, ensuring that the people around us have also had access to getting their boosters. It helps keep the workplace safer. It reduces the risk of infection coming into the workplace, and it reduces that risk of infection coming into the home, right? So we cannot, it's a pediatric town hall, and I'm thankful as a pediatrician that we're giving space to talk about kids, but kids cannot be seen in isolation of the community in which they live, the community that they go to school with. And so being able to have policies and procedures that support kids' protection until they are able to take action and protect themselves through vaccines and well-fitted masks, et cetera. And again, depending on their developmental stage, like these are really important. These are really important actions that only adults can push for, and whether it's at the policy level or at the community level or individual level.
Mm-hmm. And so important, especially given that under 5 are not even eligible to get vaccinated right now. We're still going to have to wait for that to happen. So absolutely, I think that is very critical. And I think that as parents and as, you know, members of the society, that is something we should be considering very strongly to protect our children. Another question we get very often, given that we're also moving right into peak every respiratory virus season, but especially influenza that we do have a vaccine for. Some of the questions we're getting is, what about timing of the COVID vaccine versus the timing of the flu shot? So Dr. Wahi, I'm going to put this one to you. Can I give my child a flu shot at the same time as the COVID-19 vaccine?
So you can give your child the 2 vaccines, but the recommendation is that we wait a couple of weeks, so 2 weeks between the 2, not because we think there's going to be an interaction, but because if there was any sort of side effects, we would be able to attribute them to the correct vaccine. So, you know, most children are going to have sore arms. They may feel a little bit tired afterwards, but with a discussion with your healthcare provider, you could give it at a shorter interval. I think you just need to know what to look out for.
And I'm going to do another shameless plug for influenza, for flu shot vaccines. So please do go get your flu shot vaccines, whether you're here as a parent for yourself or for your child. Please also do get the flu shot. Influenza takes the lives of too many children in Canada unnecessarily, and we have something that can help protect us. And Dr. Tampy, I know you wanted to add something in.
It's only that totally in support of what was said, but that doesn't apply to adults, that now we can give adults at the same time. So like I got my flu shot at the same time as my booster, and well, I'm still well, but the side effects are not compounded. The risk of adverse events, meaning those more serious events in the days to weeks after, are not compounded. But there's been so much experience now with giving the flu vaccine at or around the same time as the COVID vaccine in adults, that there's a recommendation from our National Advisory Committee and other international advisory committees on immunization to get the flu shot whenever you can, but knowing that parents' lives are complicated enough, just get them at the same time. To minimize the number of healthcare visits that you have to do and get that protection started as soon as possible.
Yeah, that is such a great point too. I know many kids also have needle and medical anxieties too, and having to take your child 2 times to go get a vaccine is definitely not necessarily something a parent wants to undertake as well. So that's a very, very, very good point. Dr. Wahi, I'm going to put this next question to you. And this is kind of similar to the question that we had regarding the holiday season, but something that honestly is so near and dear to my own heart as a mother to an almost 5-year-old. Can kids see and hug grandparents if they've only received 1 dose of the vaccine? Not to tug on your heartstrings or anything.
I know, and it's hard, and it's and I think it goes back to similar to what Dr. Tampy was saying, and I think we've had these discussions before around, everyone needs to do their risk assessment. And I know, Sabina, you have I hope we can share your algorithm with the town hall folks, but I think you have to think about what have been the exposures and the other contacts. Are the grandparents vaccinated? Have they received their booster? And I think, do you have opportunity and access to rapid tests? I think all of those things have to go into play. And I know you've simplified it in a really excellent way. So I don't know if you have that, we can share that with the group, but I think it's really important for everyone. I think it's important to have hugs all around. And I think everyone wants to make sure they stay as safe as possible.
Yeah, I mean, I know. I think that the hardest part of these 2 years has really been, how much children have missed out on seeing family and just being close to grandparents. And I remember that. I remember when my mother-in-law, my in-laws, and my father got vaccinated earlier this summer, and when case counts were really low, and I remember telling my 5-year-old that we were going to see grandparents, and he was just so thrilled, and he's like, can I hug them? Can I kiss them? It was literally the first question he asked. And it just really shows you, what vaccines can do in terms of where we're hopefully headed, with respect to pediatric vaccines as well. And I will share the flow chart perhaps towards the end of the webinar if we have some time left as well. Dr. Tampy, another question for you, and I know we talked about the Swiss cheese model and why it's so important to have all of these other measures in place as well. One question we get very often is that, can children stop masking after they've been vaccinated?
Well, again, we're gonna go back to where we were last winter. As people started to get vaccinated, we were still wearing masks, right? And we will have to do it, I think, through this holiday season. And I'm saying holiday season, but really it's this respiratory viral season. That's at least what we call it in the hospitals, because there's this mix of respiratory viruses in our community. We don't know what's COVID, we don't know what's influenza, and we don't know what's RSV, which has a significant burden on very young children. So I'd say that for now, even after getting that first dose, or if you get the second dose earlier on, in a shorter interval, and we're still in the thick of this surge, I could see it still being recommended, because again, vaccines are great. They're not perfect. And, we're not looking for things to be perfect, but we are just trying to fill in those gaps with different layers of protection, right? And we know that masks have done well in terms of protecting vulnerable members of our community, in terms of keeping kids in schools and teachers protected. There are so many benefits to it. And the good thing again is that, many kids have gotten used to this in terms of being able to tolerate it on their face. So, for now, yes, I think no. So no, you cannot remove the mask, but yes, to keep it on for the next while. And then, reevaluate as we come out of this surge and we see what viruses are in our midst and what other measures we have to protect our community in those spaces.
Mm-hmm. Oh, yeah, that's so true. Next year will be very interesting for sure to see where we're heading. On the same lines, Dr. Wahi, for you, can kids go back to extracurricular activities after they're vaccinated? And I know Omicron's probably going to throw some of this for a loop, but would love to get your insights on this.
Yeah, I think, I'll stress that, even with the stressors of COVID, what we've also seen is a significant increase in children and adults who've had concerns with their mental health, right? And their mental well-being. And we don't often talk about it in our communities, but it's a really important thing that we need to consider because it's really important for our health and well-being. So I think children and teenagers need socialization, they need physical activity, they need music, they need all of those things. And so what that looks like for each child will be different. I agree. I don't know what we're going to look like after this season and what Omicron's going to do to our recommendations. But I think if you have opportunities to do things in a way that you feel is safe, so well ventilated, outdoors, masked, it's really important that kids and adults are connected to the things that they love, because I think we've had a lot of loss over the last 22 months. And we've seen it in the children, right? We've seen them not doing well. We've seen eating disorders rise. We've seen mental health outcomes worsen. And we really need to pay attention on how to rebuild everybody's mental well-being through this. So I know that's not an answer, but I think, I don't think it's going to be as black and white as, as that, because I think we're all going to have to just try to figure things out as they roll.
Go ahead, Dr. Tampy.
No, these are such important considerations. And I think, we also speak as parents who are reflecting on what activities we're considering for our own children, because I don't think any children is immune. You'll pardon the pun, but I don't think any children has been immune to the effects of the pandemic restrictions, right? Even the most bubbly, lively kids have internalized this in some way that we're going to be hearing about if we haven't already heard. So, I think that there are, when we get that black and white question of, can I go back to this extracurricular activity, getting back to those protective measures, it's helpful to look at what is this extracurricular activity? What are the risks of transmission? And what is that activity group doing to reduce the risks? So, if our kids are asking if they can go cross-country skiing, which I don't think is very common in Toronto, but it's common in Ottawa, that can be a very low-risk activity because you can distance, you can stay outside where the ventilation is excellent. And there's you go into a cabin to warm up, you put on your well-fitted mask, right? And you self-screen before you go in. You don't come in when you're sick. All these measures will help to reduce the risk in that setting. Hockey has been implicated, and some other sports have been implicated in outbreaks, but it's really, there a lot of the concerns or conversations happen around the pre and post activity as well, right? So being in the change rooms, getting together for for snacks or drinks after, carpooling to the events. Like these are all activities where, again, it's our mindfulness and our individual actions that can make the difference in those settings. So where I'm carpooling with someone, am I masking? Am I putting the windows down? Are we sitting as far apart? Like the more you add to it, the less risky the interaction is for infection spread. So, these are the considerations that I think about when making recommendations around extracurricular activities, and then looking at the supports that are in place by that activity group to demonstrate their commitment to safety for the individuals who are in the activity, whether it's extracurriculars for myself, because I want to, have my brain thinking about other things than COVID-19, or for my kids while they are waiting for the vaccines to help in their protection.
Yeah, I think that is so important, right? It's our mental health, and it's also the mental health of our children. And of course, like finding things that are safe activities, especially during what's going to be a pretty long and cold winter is going to be exceptionally important. We have quite a few questions coming in from our audience, so I'm going to take a couple of them right now. The first question, and I'm going to open this up to either of you as to whoever would like to answer. What do we know about how much protection babies have if the mother is breastfeeding and vaccinated?
I feel like Geeta and I are being polite.
I know, you go ahead. You go ahead, Nisha.
So if babies are being breastfed, they're getting a certain kind of immune protection. It's not complete. And so, and that is why we've been really supporting mothers who are looking to get vaccinated during their pregnancy, because the data are so consistent that vaccination during pregnancy protects the mom while she is in this immune compromised state, which is pregnancy. And it also, those antibodies transfer to the baby, and it's a different kind of set of antibodies that transfer to the fetus, or and are staying with that baby for the first few months of life. It's not as clear that the antibodies from the breast milk add that much more. And that's certainly something that we're paying attention to with this new variant, because Omicron, again, in a different population that is in South Africa, but there was a substantial proportion of children who were hospitalized that were in that under 1 year age group. And so again, in the absence of evidence as to what's going on for those babies, we do have very good evidence to reassure moms that getting the vaccine during their pregnancy is a great idea for them, and it's protective for their baby for the first few months of life.
I think that passive transfer is really key, especially in pregnancy. Dr. Wahi, would you like to add anything to this?
No, I think that was
okay.
Great answer.
Okay, amazing. All right, our next question is, so this is a great question, and I think a lot of schools now in Ontario are sending kids home with rapid antigen tests. And so there is someone in the audience who is talking about the importance of explaining the importance of these rapid antigen tests. And also on social supports that are available if a family member tests positive and they need to quarantine. I think this is such an important point, going back into how to actually, protect families and support families during this time. It seems as though there are parents who are returning rapid antigen tests that are given to the school. And so I guess this audience member would like to know, what is the rationale for that, and why are rapid antigen tests important? So I know that's a bit 2 questions in one, or maybe 3 questions in one, and maybe we could tackle 1 or 2 of them. And maybe we could start with the rapid antigen tests, and I could flip a coin if you'd like.
I can start, and then Nisha can finish me. We talked earlier tonight about doing assessments of risk and understanding what the risk might be of, for example, getting together with grandparents or other things. And so, rapid antigen tests can be part of those risk assessments. So knowing, right before you enter into a situation, if you're negative or positive, can help reduce a risk where we've, all heard stories and either in the media or through friends and family of people getting together and then, days later finding out someone was positive, and now everyone's been exposed and exposed other people. And that's how this is all continuing. So it's part of that, of that understanding. And I see in the chat that someone, I think Andrea's put in information for families in Thornhill. And I think that's, the excellent work of all the agencies here and in the community that we look to for those supports for families that may be positive or may need extra supports as they get through it.
I think, I think going back to that Swiss cheese model, which I absolutely love, it's just rapid antigen tests are a fantastic tool in our toolbox. I mean, of course, PCR tests are considered the gold standard, but there's so much utility in rapid antigen tests, especially if, going back to some of the questions we had before about hugging or seeing your grandparents, I think this would be an excellent place where rapid antigen tests could also be used. And if we have time at the end, I will show my flow chart that actually incorporates rapid antigen testing into your decision guide on, when you are going to be gathering for the holidays. One quick question that we have over here is in terms of when we talked about the vaccines not being as effective with Omicron, what does that mean in terms of percentage? And I know I don't think we have any information on this yet, but Dr. Tampy, if you'd like to take that one.
Yeah, actually, the UK data has been published and posted, and they were now I'm going to be put on the spot for a number, but it was between 30 and 40%. It was not more than 40% after the second dose. If it was more than 9 weeks, if it was at the, it was at above 80% if you were 2 months out of your second dose, and then it waned down to the 70% for symptomatic infections, for severe disease, and then 30 to 40% for symptomatic infections.
Okay, that's good to know. I actually was not aware of that, so thank you for highlighting that to us. I think that kind of covers all of the questions we really have. We had a couple of questions that were based on some of the content that we've already answered earlier on during our presentation. And so for those who missed the first half of the presentation, don't worry, we will have a full recording of this in all 5 languages that will be posted and shared. So please feel free to watch the session after as well, so that you can look up the answers that you did miss to some of these questions. If we have a second, I can pull up the flow chart really quickly. Can everyone see this? Okay, so this is the flowchart that we've kind of referred to a couple of times, but it really just takes you through an easy guide. I think a lot of us have decision fatigue right now as well with respect to everything that is going on for the last 2 years. This simply takes you through what happens if you have cold symptoms. Best thing to do is to get tested and quarantine yourself until you have results. But if you don't have any symptoms, then it takes you through whether everyone's vaccinated or not. Rapid tests as an additional layer on top of that, and boosters now that they're available to everyone who is 18 plus, but especially important for those who are immunocompromised, those who are elderly, those who have high risk factors. These are all important groups that may be at a risk for severe illness, should get their boosters as soon as possible. And then of course, all the things you can do to try and make things safe. So could you eat outdoors, which is a little tricky, I would say, living in Ontario during winter, they are calling for a white Christmas as well. But if that's not possible, then be cautious by improving the ventilation in your homes. That you could be opening windows, it could be using HEPA filters, it could be one of many such different methods.
Can I just say one thing that two things that I really like about your flowchart, and if you don't mind going back to it, because
Yes.
I want to bring attention to it in light of our conversations around rapid antigen testing. I really like the fact that it's stated up front, if you have cold symptoms, you stay home. Or if you have been exposed to COVID-19, you stay home. There's no role for rapid antigen testing there to be able to go out and have a holiday party. Do you know, like if you have symptoms, if you had an exposure, it's a different kind of day for you, right? Or it's a different kind of few days. And then, you know, seeing the rapid testing as a red light strategy. So it's a red light to stop and not go. Rather than a green light, because when we go, we're still applying those other levels of protection just in case someone else in the room has undetected, unrecognized COVID-19 and can become infectious over the course of the evening. So doing the rapid test is close to the event in question, and then maintaining caution. These are excellent messages that I think come out of that flow chart. So thank you for putting that together.
Yes, for sure. So having all those tools in the arsenal that we can use to be able to gather safely, especially as we see case counts rising quickly in Ontario and across Canada. So this actually wraps up our time together. I can't believe we've actually had an entire hour of discussions. Feels like the entire completely flew past really quickly. I hope the information that was shared today helped answer some of the questions that you may have had, and most importantly, encouraged you to go get your children vaccinated. I know that parents will still have questions and concerns because that's our job as parents. And I encourage you to please reach out to someone who is trusted, a trusted healthcare provider. Could be your child's doctor, your pharmacist, or even someone in the community or a faith leader. Find credible sources for information. The Public Health Agency of Canada is a fantastic source, as well as the kids vaccines FAQs that have been put forward by the Focused COVID Communications Group is another fantastic resource that people can refer to, and also see the South Asian Health Network's website. We have lots of materials that are translated in several different languages, and these are all resources for you that you can use. We'll also have the recordings of these posted shortly in the next day or two, so you can come back and refer to this as well if you have questions, or pass it on to other parents that you may feel might benefit from the conversations that we had today. I want to really thank our two speakers today. Thank you so much, Dr. Tampy, Dr. Wahi, for being here with us and answering all of these questions that we received from our community members. Your insights, your expertise, and your opinions, especially as parents and as physicians, have been so incredibly important. So thank you so much for sharing all of that knowledge and expertise with us today. And I also want to thank everyone who's joined us here tonight. Thanks for being here. Thanks for your questions. And once again, thank you to our community partners, because without our community, none of us would be here today. So greatly appreciate all that support and all the work. Thank you so much for joining us this evening. Have a lovely evening. And I think there is a quick end of session poll that we'd love to do. If anyone could quickly take the time to answer these questions, that would be very helpful for us, especially as we plan new town halls in the new year. Okay, I think we have all of our responses here. Thank you so much, everyone. Have a great evening. Bye-bye.